Now on to tips for recovering from surgery at home, how to prepare, of course, what kind of care will I have to provide for myself post-op, and what can I do to help with my recovery. Those are all bundled into our post-operative instruction sheet. And we start with the actual condition of your foot. We will scrub inside the operating room with an antibacterial, but we like you to wash your foot prior to surgery. That would be nice. Have it clean prior to the hospital. Otherwise, afterwards, you have a sterile dressing, a ACE wrap that keeps everything a little bit compressed. And then if we don't want anything to move around too much, we may put you in a posterior splint. That's a fiberglass cast that goes from the foot all the way underneath the calf. And there'll be an ACE wrap from the toes to your knee. Now that can come off if it feels tight, but do not remove the ACE wrap underneath. Then there's preparing prior. Keep it simple, just eat well. You can't beat a multivitamin. And then post-operatively, same, eat healthy, but you can't beat protein supplements like either whey protein or soy protein. The body's repairing, and it really needs a lot of building blocks during that period. Then have your medications close. You can take your anti-nausea with your pain med to avoid that side effect, and it actually makes the pain meds work better, and your antibiotics you'll take the next day. We like you to wean down after a day or two to anti-inflammatories, because if you do take the pain pills repetitively for 2, 3, or 4 days, they don't work as well at night when you really need them. Then there's the ride home. So make sure your foot is on the passenger seat, out, on and up in the air, and the other one's on the floorboard, because really everything's about hemostasis, or letting everything clot the first day and not bleeding through the dressings. At home, keep it around heart level in a recliner or just a little bit below. Definitely for the first day or two, that's what we want the most to avoid swelling. You can also apply ice every 20 minutes and off an hour, on for 20 minutes, off an hour. That helps with swelling as well. If it does bleed through the bandages, blood is sterile, so you can just let it dry. I'm going to see you on Monday anyway. We don't take the dressings off anymore unless, of course, it's soaked through or dripping out. Hope that was helpful for you. Look forward to seeing you in the operating room, and have a great day.